Mental health is an often neglected part of a person's well-being, especially in low and middle income countries like India. The situation becomes even more worrisome when one realizes that the number of psychiatrists to cater to a population that is as big as that of India is only between 3,500 to 5,000 psychiatrists. An average of one psychiatrist for every 2 lakh individuals. The gap between mental health professionals and mental health patients is huge and is widening.
That patient did not like us in the house, so we did the setup, we walked out. When the sister got comfortable with patient, she was in front of the...
Sangat, a pioneer in the field of mental health research, is experimenting with technology to reach out to a wider population of mental health patients.
What we are trying to do in the Impact India program is to use technology to bridge this huge geographical barrier. What we are doing is using telemedicine to bring the psychiatrist and other specialists closer to people's doorsteps, which means that people who have mental health problems do not have to commute long distances from the villages that they live in to meet a psychiatrist who is based in the city. We are using technology like video conferencing to connect the psychiatrist to the patients living in remote parts of the state.
Impact Clinic is currently located in South Goa's Baroda village under the Kepe Taluka. Sangat healthcare professionals visit the households of mental health patients and set up the equipment meant to enable a video interaction between the patient and the psychiatrist. In other cases, patients like to visit the clinic themselves.
Kepe Primary Health Center has about 6 sub-health centers under it. So we started this project over here in the month of December 2017. In other Sangat projects, we go to a primary health center and we screen patients who stand in queue for their health problems. Here we are going out into the community. We tell people about what mental health problem is. We create awareness, we conduct awareness programs. These awareness programs sometimes are attended by 5 to 6 women, and sometimes there is a crowd of about 150-200 villagers as well.
Good news for you, he's feeling much better than first session, and कमी आसा म्हणटात ते मातशे गब्बर जाता तेन्ना मातशे भिवप जाता तांकां पूण पयलीं परस खूब कमी आसा.
Impact's software platform enables the psychiatrist to write the diagnosis and the prescription on the platform itself. Diagnoses are saved on the platform and prescription can be printed at the patient's end.
हाजेबद्दल कितें प्रश्न आसा तुमकां हे कळ्ळें फकत वाचपाक जाय जे त्रास तुमकां लागता ते आमी बरोबर करता म्हणजे दिल्यात बॉक्सीस आसा
आमचे कडेन हें इंग्लिशीनूय आसा आनी मराठीनूय आसा न्ही हें कोंकणी मराठीनूय आसा समजा वाचून समजुपाक कितें जर त्रास
आतां आसा
पयलीं कितें जातालें जस्ट जशें म्हटलां की आमी कावन्सिलींग सेशन्सूच जातालीं त्या भायर कांय जायनाशिल्लें आनी डॉक्टर पेशंटाक समज जर डॉक्टराची गरज आसा किंवा मेडिसिन्स आसा जाल्यार डॉक्टर आमकां पेशंटाक एक हेजिटेट जाता जाल्यार आमी कितें सांगपाक की आमचे कडेन मेडिसिन्स तुमकां दिवपाक ना समज जर सिवियर आसा जाल्यारूच आमी तांकां भायर रिफर करतालीं एक तर IPHB किंवा आजिलो हॉस्पिटल पूण हांगा कितें जाता की डॉक्टर आशिल्ल्या कारणान पेशंटाकूय बरें जाता तांचे त्रास सांगपाक आनी डॉक्टर मेडिसीन हांगा प्रिस्क्रायब करून तांकां रोखडेंच प्रिस्क्रिप्शन मेळटा आनी पेशंट हॅपी जाता हातून डिफरन्स हो खूब बरो आसा की पेशंट बेजिकली चड हॅपी जाता की कावन्सिलींग सेशन्स ही ऑफकोर्स लोकांक आवडटात पूण मेन डॉक्टराचो एम लोकांच्या मनान घुशिल्लें आसा आनी डॉक्टर हांगा मेळिल्ल्या कारणान एक वेगळो अनुभव कसो आसा.
This project, what we are trying to do is see if it is possible to use to to see how feasible it is to do this, to see how acceptable this is to the patient, because this is probably the first time they would be consulting a doctor effectively through a screen, a monitor, a laptop, and they are used to meeting doctors face to face. So we want to see whether this is acceptable to patients, and if this is so, then we will be able to try to influence policymakers to make this kind of a telepsychiatry program a part of normal mental health care delivery in the state and other parts of India.